Congenital adrenal hyperplasia is an extremely important condition for which the parents face a lot of challenges. Congenital adrenal hyperplasia is a group of adrenal disorders which are very rare, 1 in 15,000, based upon genetic causes, which typically are associated with abnormalities in adrenal function, causing salt loss, atypical genital appearance, and early puberty in boys. The conditions require lifelong treatment and they may be life-threatening if not treated appropriately. Adrenals are one of the most important glands which are located in the body just above the kidneys. These glands produce three important group of hormones. One are the glucocorticoids, which take care of the glucose, the blood pressure, the stress, and a lot of other factors. The second are the mineralocorticoids, which basically take care of the salt and the blood pressure regulation. And then we have got the androgens, which are responsible for causing changes which are associated with hair growth, with acne, with changes in odor. And without the glucocorticoid and mineralocorticoid, an individual cannot survive. The adrenals are controlled via the pituitary, which secrete the hormone adrenocorticotropin releasing hormone, ACTH, which regulates the production of cortisol, which regulates the blood pressure, the sugar, the stress response. It also regulates partially the aldosterone production, which causes salt retention, and DHEAS production, which is involved in pubertal development in boys, changes in the odor in girls, and hair growth in that regards. The most common form of congenital adrenal hyperplasia, which is 21-hydroxylase deficiency, causes a block in the production of aldosterone and cortisol, which causes deficiency of these two hormones while increasing the amount of the pituitary signal, causing adrenal enlargement and subsequently increased level of DHEAS. So the manifestation of this disorder basically represents the deficiency of the glucose controlling cortisol, the salt controlling aldosterone on one hand, and excessive production of DHEAS, which causes rapid pubertal development. The excess amount of androgens would basically result in increased amount of hormones in girls, causing changes in the appearance of their genitalia, which is sometimes referred as atypical genitalia. It will also cause early puberty in boys if it is not controlled properly. In situations where there is a certain amount of hormone which is being produced, the person may escape this salt wasting crisis and they may actually present just with abnormalities in the genital appearance in girls and early puberty in boys. Condition is basically a genetic disease, or autosomal recessive disease, because the gene regulating that particular enzyme is located in a chromosome which has got one gene from the father and one from the mother. Both the genes have to be defective to cause the disease. So both parents of children who have congenital adrenal hyperplasia have got one gene which is affected, would be absolutely normal. They will have no clinical features and they will act as carrier of the disease. 1 in 4 child or sibling of an individual who has congenital adrenal hyperplasia will have a chance of the disease, and half of them will also have a chance of being carriers. So the risk of having a sibling, a brother or sister, which is going to have the same disease is around 25%. The treatment of the condition is pretty straightforward. All we have to do is to give a reasonable amount of the glucocorticoid, which is given as hydrocortisone or hyzone, and mineralocorticoid, which is given as fludrocortisone or Florinef, along with salt. Salt replacement is very, very important in the first year of life, because then the intake of salt is very limited. If we give too much of treatment, that will have an effect with regards to decreasing growth and causing more weight gain. On the other hand, if the less treatment is given, the bones will run fast and the child will land up short. Now, since this deficiency is because of our inherent disorder in the enzyme, the treatment required is also lifelong. One of the most important thing to remember is that these individuals are at an increased risk during stress. So all of us are able to increase our cortisol hormones during stress, but children with CAH or congenital adrenal hyperplasia cannot, and therefore there is a need for increasing the dose as far as stress. If the fever is there, which is more than 100 degrees Fahrenheit or around 38 degrees Celsius, there is a need for minimum doubling of the steroid dose. So if you are on 1 tablet twice a day, make it 2 tablets twice a day. If the child is looking sick, is having vomiting, is not looking that well, you increase it 3 times. So maybe if you are on 1 tablet twice a day, importantly, the child is not accepting the medicine, looking sick, always keep the hydrocot injection which should be given to the child, which can very well be life-saving. Cardinal principles in the management of CAH are never miss your medication. If you miss it once, it can have a devastating consequence. Always increase the dose during times of stress, and very importantly, you need to be careful in terms of your visits and blood tests as prescribed. Hyperplasia is basically a genetic disease. There are various tools which are available by which we can identify the disease at the right time in the prenatal period, but for that a genetic testing of the baby and the parents are absolutely important, and this should be done before even planning pregnancy. Completely normal outcome is possible with congenital adrenal hyperplasia, and we can expect a normal development with regards to physical, mental development and career options and even reproduction. Congenital adrenal hyperplasia, therefore, is a life-threatening disease, but one which is highly treatable, requiring lifelong medications and careful follow-up to achieve a successful outcome.